So this is a simple paradigm that I like to use because it says something about how the results in our culture are created, and it starts first with what we believe to be true, what we think in our minds. The world is flat? No, it's round, you know. So we change our mind. And behind that new belief, in this case, the results are produced by the actions that we engage in, which creates an experience that further validates our belief, right? So in our system, oftentimes we've had non-recovery results show up because we didn't believe recovery was possible. We didn't believe people could take on their life. We didn't believe that people could take care of themselves and make decisions and that we had to take care of them. And so we engaged in actions and created programs that were built on maintenance and stabilization and caretaking and so forth, right? And of course, the experience then was not recovery because we didn't believe it was possible. So again, we have to change our mind to produce recovery results first by believing that everybody can recover, right? If we really embrace that, when we really believe that, it has huge implications for the actions that we engage in, and it's been my experience that then people have the experience of recovery in their lives. What we believe, creating actions that creates an experience that reinforces the belief. So, we changed our mind, and 10 years ago, we were a traditional mental health provider in our mental health system with the usual kinds of staff and usual kinds of services and treatment and so forth. And as we started to really listen to people about their experience of having received services from us, they told us that our mission statement, which was to be the premier provider of crisis stabilization services, wasn't very inspiring. Well, I thought it was great to be the best, you know. We're going to be the best. But the best at what? You know, stabilization? People said they wanted more than that. That our expectations were way too low and that they were possible of so much more. And so we began to explore how to raise our expectations and see what showed up. So first thing we had to do was we had to recreate our purpose. We had to figure out really what our mission really was. And our mission wasn't really to recover people. You know, we can't do that. That's up to people themselves, right? And we realized that our mission, our purpose, was to create an opportunity and to create an environment so people could get the power to recover. And of course, we wanted to have some success. We wanted to see people thriving. We wanted to see people achieving their goals, their hopes and dreams, and realize that we had to do this in connection together. And we had to be connected to ourselves, who we really are, what our purpose is, the people around us, right? And finally, what it all means, our meaning and purpose. What are we here for? So we changed our mind about what our mission was. So with the passion and the hope from our new recovery and mission, we began to expect great things. And great things began to show up. The first experience perhaps we had that caused us to start to think differently was discovering the Wellness Recovery Action Plan, you know, the WRAP. And this is how we did this. We didn't have somebody come to us and say, you should do this. We didn't have somebody come to us and say, we've got money for you to do this. It seemed that it was the right thing to do. And so we got busy doing it, and we began to have WRAP classes. And after about 6 weeks, we had 12 or 15 people that had completed their WRAP plans. And we decided to do something else that we'd never done before, was to have a celebration. You know, usually we do something we call discharge. Sometimes under circumstances that perhaps we're not as proud of as we'd like to be. But let's have a graduation. Let's celebrate people's accomplishments. And so we did, and we got together and we heard stories. And you know, the most amazing thing was there were several people that had been in our services, perhaps briefly in the crisis service or something like that, that we didn't recognize. They were transformed people. And the most amazing thing that changed our minds was they did it themselves. They did it without us. And we thought we were necessary for their recovery. But once they got the tools, once they got a dose of hope, once they heard that someone else had recovered and heard their story, they did it themselves. The other thing that we did, and I can't say that perhaps this was deliberate and strategic, but we did something really hard. And I think when we're going to take something on that's a recovery challenge, we should do something that's really challenging. And maybe even that we think is impossible. And I know each one of us sitting here today can think of a few things that, oh, that'll never happen, you know. Well, guess what? Then it won't, you know. So take on something that maybe seems to be impossible. So one of the areas that we were very concerned about was the way we treated people in our crisis and emergency service, and the kind of what now seems so disrespectful, right? The seclusion, the restraint techniques, some cases the takedowns, the forced medication and forced treatment, that people said in fact was one of the worst things they'd ever experienced in their life. But we did not know how to do this any differently, because we were convinced that this was necessary to keep people safe, right? And so we got busy with that, and we started to work on that. And we made a declaration that we were not going to engage in violent practices with people, and we were not going to use force. And we were able to achieve that because of that declaration and a belief that somehow we could find a way to be with people that was more respectful.